Dickinson. I'm with RTI International, and this webinar is entitled Providing Services to Youth in Foster Care and Juvenile Justice Systems. I'm going to go ahead and introduce our first two presenters, and we'll have some others introduce themselves a little further into the presentation. Rachel Rosenberg, PhD, MSW, is a researcher in the child welfare area at Child Trends. Through applied research, Dr. Rosenberg aims to improve services and supports for young people transitioning out of foster care and into adulthood. Dr. Rosenberg has expertise in quantitative and qualitative methods, youth and community engagement, research to practice translation, and project management. Her recent work includes leading a data and self-evaluation partnership to ensure young people transitioning out of foster care have the resources and opportunities to succeed in adulthood, convening a large research alliance to inform priorities of research to practice translation center focused on sexual reproductive health, and an evaluation of two programs aimed at increasing high school graduation among young people in foster care. Dr. Rosenberg will be followed by Rico Hall, who is a program manager at the Office of Juvenile Justice and Delinquency Prevention. His professional experience covers the areas of education, psychology, program management, health and human services, and criminal justice. He received his undergraduate degree in psychology from the University of Tennessee at Chattanooga, education specialist and Master of Education degrees in education from Tennessee Technological University, and an MBA from the University of Phoenix. Currently, he's pursuing an education doctorate in the Human and Organizational Learning Program at the George Washington University Graduate School of Education and Human Development. In efforts to serve the adult and youth populations in low socioeconomic disadvantaged communities, he's worked on the local, state, and federal levels. And Chloe, go ahead and go to the next. Oh, I'm sorry. I'm just also going to mention that we have panelists today joining us from the Capacity Building Center for States, which provides TA to state and territorial child welfare agencies on behalf of the Children's Bureau. Frankita Jenkins and Jazz Snell are young adult consultants, while Christine Gunningham and Eric Warner are lived experience engagement specialists with the Center for States. Raven Prophet serves as the young adult consultant coordinator and will be the panelist facilitator for today. As I said earlier, they'll share more information about their backgrounds during the panel discussion. Okay, now go to the next slide, please, Chloe. And these are just briefly some webinar logistics. Please mute yourselves when you're not talking, and turn off your video if you experience any connection issues, which should help. Type questions you have in the chat. And if you are messaging someone directly, please make sure you're not messaging everyone. Check before you do that. And just as for reference, the transcript and the recording will be available after this webinar. And like Cameron said, we will have some time at the end for questions and answers. Next slide. Next slide, please, Chloe. Thanks. And please participate and engage. We want to hear from you, and we want you to hear your colleagues. So having a balance in participation will allow for all voices to be heard. Please be fully present. Want to just ensure that our engagement is a focus so we can maximize our time together, and we will also be dedicated to beginning and ending on time. Next slide, please. Okay, so this is our agenda for today. As I said, we will be starting with a background on youth in foster care and juvenile justice systems with Dr. Rosenberg, and then Rico Hall will be talking about partnering with the juvenile justice systems, and we will have the panel on engaging and linking youth in SRAE programming, and then with a question and answer and some wrap-up information at the end. Next slide, please. So these are our objectives. We want to help all the participants understand the experiences and needs of youth in foster care and juvenile justice systems, learn about effective ways to partner with child welfare agencies or the juvenile justice system within your communities, learn best practices, strategies, and opportunities to engage youth in foster care and juvenile justice systems with SRAE programming specifically. And next slide, please. Okay, so I'm going to pass it over to Rachel Rosenberg, who will share some information on the background and data about youth in foster care and juvenile justice systems.
Thanks, Denise. It's great to be here with all of you today. And to get us started, we are going to start with a poll. So if we could go to the next slide. We want to hear from you. Tell us about your experience working with youth in foster care or juvenile justice systems. The poll will open and you will see different response options for the ways that you are currently working with young people in foster care or juvenile justice. Great, so it seems like quite a few of you are already working with youth in one or both of these systems, and with a handful of folks who are in the very early stages of working with youth in one of these two systems. So that's great. We'll give it just another couple seconds if anyone else would like to participate. Seems like participation has slowed. So that is great to keep in mind. I think that the material we have today will be helpful to everyone, but particularly those who are either already working with young people or in the early stages of designing programs to work with young people in foster care or juvenile justice. We could close the poll and go to the next slide. Before we dive into the experiences of older youth in foster care and juvenile justice, we're going to define some terms and set common language to use throughout today's webinar. The foster care system includes any young person who is in out-of-home care, including those placed in a kinship placement, congregate care placement like a group home or residential facility, or a relative foster home. And juvenile justice includes any youth on probation in a detention center or alternative placements ordered by the justice system. Lastly, crossover youth or dually involved youth are young people involved in both the juvenile justice system and foster care system. Young people can be involved in both systems at the same time, or can be involved in one system at a time, such as juvenile justice and then foster care, or foster care and then juvenile justice. Lastly, during today's webinar, we are discussing young people between the ages of 14 and 21. And so when we refer to young adults or young people, we're talking about ages 14 to 21. Young people in foster care and juvenile justice are resilient and are often forced to face adversity throughout their lifetime. When designing programs and working with youth, it is important to use a strengths-based perspective that centers the individual young person. All young people face challenges throughout the transition to adulthood, and working with them to identify their interests and strengths can help mitigate these barriers. Many young people leaving foster care or juvenile justice go on to live happy and healthy adult lives. Therefore, it is important to acknowledge young people's expertise on their own experiences, needs, and interests. When working with young people, be sure to center their experiences and expressed interests, and not focus only on stigmatizing perspectives and assumptions. The child welfare system was originally designed to protect young children and infants from physical and sexual abuse. Because the system was designed to serve infants and children, the policies in place often don't take into account developmental stages of adolescence and normal adolescent behavior. The child welfare system is designed to be risk adverse. However, adolescents are learning about healthy and unhealthy risks, which is developmentally appropriate behavior. While learning how to take risk and learning boundaries are developmentally appropriate behavior, this behavior is often punished within the systems and can result in placement changes or increased level of restriction. Similarly, the juvenile justice system is modeled after the adult legal system in the country, meaning it is not designed with the latest adolescent brain science in mind. The adolescent brain functions differently than the adult brain, and systems serving adolescents should model services that best meet the needs of adolescents. The adult legal system assumes adults are making rational choices and should therefore be punished when crime occurs. However, the juvenile justice system is supposed to be more focused on rehabilitation. However, without a model for this and services designed for adolescents, the system may not be meeting the needs of all young people. With neither system designed to meet the needs of adolescents, particularly older youth, young people in foster care and juvenile justice may not receive the sexual and reproductive health education they need. Now we're ready for the next slide. Thanks. Now that we've talked a little bit about the two systems and defined the populations that we're talking about, we are going to switch and talk about the experiences of older youth in foster care. Most older youth ages 14 to 20 enter foster care due to neglect or parent-child conflict. Once in foster care, around 20,000 young people age out of foster care each year, meaning the system failed to provide them with a permanent legal family after removing them from their family of origin. Of the older youth population in care, it is fairly evenly split between males and females, and older youth make up about 15 to 20% of all children in foster care each year. Black and Indigenous youth and families and low-income families are overrepresented in foster care. This is due to systemic racism and biases that leads to more Black, Indigenous, and low-income families being reported to Child Protective Services, being investigated, and ultimately removed from their homes. The oversurveillance of communities of color and low-income communities often drives the overrepresentation within care because of the increased presence of police and social workers within those communities. Next slide. Now that we've discussed who older youth in foster care are, we will review some young adult outcomes among those who have ever been involved in the foster care system. These outcomes are often a result of their involvement in foster care, which can include increased exposure to trauma based on abuse or neglect and being removed from their family of origin, could include a lack of social support and exposure to violence during childhood, or barriers to adequate health care. Young people who have ever been involved in out-of-home placements experience an increased risk for having sex for the first time at a young age, higher rates of teen pregnancy, increased exposure to sexual trauma, increased risk for sex trafficking or sexual exploitation, an increased risk for rapid repeat pregnancies, and higher rates of STIs and HIV. While older youth only make up about 20% of the population in foster care, they have a very different experience than their younger peers in foster care. These experiences include increased placement instability, school instability, and older youth are more likely to be placed in a congregate care setting. All of these factors may decrease their access to needed sexual and reproductive health education. While we do not have national data to provide an estimate of pregnant and parenting youth in foster care, it is estimated that between 33 and 49% of older youth in foster care have ever been pregnant or impregnated someone else. This is higher than their peers not in foster care and may indicate a need for increased access to sexual and reproductive health education. We are now going to switch and talk about older youth in the juvenile justice system. Youth in the juvenile justice system experience many of the same barriers and young adult outcomes as youth in foster care. This slide presents a bit of background information on the juvenile justice system, which includes youth on probation, youth in community placements, and youth in detention centers. Youth come into contact with the juvenile justice system for a range of reasons, including behavior problems, status offenses such as truancy or illegal actions, including both misdemeanor and felony. In 2020, around 500,000 young people were arrested and had an initial contact with the legal system. Of those young people who were arrested and entered the juvenile justice system, either through probation or detention, 28% were female and 72% were male. As I mentioned, youth can be in a number of placements, and it's important to remember the majority of youth in juvenile justice are not in a detention facility and instead remain in their communities. Similar to foster care, there is an overrepresentation of Black, low-income, and LGBTQ+ young people due to over-surveillance in these communities and other systemic barriers. As mentioned, young people in juvenile justice experience many of the same young adult outcomes as young people in foster care. Young people with juvenile justice experience are at an increased risk for having sex for the first time at a young age, higher rates of pregnancy, which is estimated by age 19 to be over half of young women in juvenile justice, and 18 to 31% of young men in juvenile justice have become pregnant or impregnated someone else. It includes increased exposure to sexual trauma, having multiple sexual partners, having unprotected sex, and higher rates of STIs and HIV. These outcomes are often a result of their involvement in the justice system, and also increased exposure to trauma, lack of social support and supportive adults in their lives, exposure to violence during childhood, and barriers to adequate health care. We will also note that many young people in juvenile justice, similar to those involved in foster care, do transition out of these systems to experience these outcomes and other outcomes, and go on to live healthy and happy adult lives. Go to the next slide. While it's difficult to know the exact number of young people who are involved in both systems due to the lack of national data collected on dually involved youth, we do know information about populations involved. We know that dually involved youth are more likely to be Black or Indigenous, more likely to be female, more likely to be LGBTQ+, and more likely to use other social services than young people who are not dually involved. Now that we have covered the experiences of young people, we want to remind folks that young people are resilient and go on to do wonderful things in adulthood. It's important to center the individual young person in programming and services. Many young people with experience in the juvenile justice and child welfare systems also report wanting to experience higher education and starting a family when they are in a position to do so. They also report plans to become entrepreneurs or a career in advocacy to fix the system they experience. Lastly, some young people report wanting to work within the systems they experience. Regardless of what young people go on to do in young adulthood, it is important to remember that they are resilient and can do anything when provided access to the resources and opportunities to thrive in adulthood. Access to sexual and reproductive health education is a core component of this. I will now turn it over to Rico Hall.
Thank you so much, Rachel, and good evening, everyone. My name again is Rico Hall. I'm a program manager for the Department of Justice, more specifically State and Tribal Relations and Assistance Division under OJJDP. And so I want to give you an overview about our OJJDP priorities. But before I get to those, I definitely want to highlight two news breaks. We're actually celebrating at OJJDP and observing two different initiatives at the moment. The first being the National Bullying Prevention Awareness Month for the month of October. And we observe this for many reasons, but basically to prevent youth of hate crimes, as well as to identify based bullying initiatives that pretty much focus on prevention and early intervention to combat these effects of bullying and hate crimes, such as sexual exploitation and sexual offenses. But as of last month, President Biden and his administration have added on to our work at OJJDP and now have also increased our awareness to now, for the month of October, the Youth Justice Action Month. Of course, we're full of acronyms in the federal government, so it's YJAM. And actually, I'm just getting out of that particular meeting where we flew in multiple youth to hear from the horse's mouth, people that are receiving these services of ours. So they represented over 15 states nationwide. And we also had multiple detention centers represented on the webinar where they were introducing multiple youth at the time that are currently incarcerated, more specifically the state of Washington. And so President Biden has issued this proclamation just to designate YJAM for the month of October, and pretty much highlighting how OJJDP joins partners to raise awareness about the impact of juvenile justice on children. And a little highlights that we received from a lot of the youth that presented, which was well over 30 for that hour and a half. They're telling us as service providers that the system is working exactly how it's supposed to, locking brown and black kids up and not really supporting them once they get out of these detention centers. And our administrator, Elizabeth Ryan, definitely heard them and made that point at the end of her presentation to say that we're going to do more about it, which is starting with things like us partnering with agencies like FISB and trying to realize how we're pretty much serving a lot of the same communities in the same zip codes. And so we're working really hard behind the scenes when it comes to how can we better improve our work on an individual level, but more so collaboratively. And so one of the things that that we have done in the past, working with FISB and their leaders, we have definitely addressed the age scale, where we're at least understanding that there's a developmental approach, which is behind the brain science, and understanding that these kids are not necessarily young adults at the time. And so even these youth that presented today mentioned that multiple times. And so there's a initiative that a lot of states are taking under OJJDP's programs that are trying to now raise the age. And so we would typically consider youth probably ending at 17 or 18. However, as you saw from Rachel's presentation, you're seeing they're now going into the early 20s. And so what we're doing at OJJDP is supporting these states that are now trying to create policy reform that are increasing the age limit possibly between 24 and 26 years of age, just depending on the crime. And a second initiative that we're addressing is actually closing detention centers, youth detention centers, for that very reason. We're reallocating the resources and also reallocating the funding to community-based programs such as yourselves. And so California is doing a really good job of that now, and they actually even put an end date where they want to close all of their juvenile detention centers at some point. But to Administrator Ryan's priorities, they definitely reflect the office's guide and philosophy to enhance the welfare of America's youth and broaden their opportunities for a better future. To bring these goals to fruition, however, OJJDP is leading efforts to transform the juvenile justice system into one that will treat children as children, not as young adults. Second, they will serve children at home within their families, in their communities, and meeting these children and their families where they are. And third is opening up opportunities for system-involved youth. So let's go back to the treat children as children for a minute. The juvenile justice feels decision-making must be informed by science and research. And so we have a lot of science that backs our or supports our efforts, where we have an entire system which you'll have as far as OJJDP's resources that's speaking about our performance measures and our models. And so we have different tiers that are allowing not only just for organizations to utilize evidence-based models like PYD, positive youth development, but we're understanding that some of these states and localities have more emerging and new issues that are coming up that are specific to their region, that are specific to their states. And so we have a component in there that also highlights what we call promising practices, which it has a little science behind it, and it also has a few years behind it to show that it is working in those particular localities in those states. We just need more evidence and a bigger sample size to then put it into the evidence-based category. And so we are trying to ensure that young people are adjudicated fairly and given opportunities to learn and recover from youthful mistakes and not pay for their youthful mistakes in their adulthood and throughout their adulthood. But as far as the meeting these youth where they are, community-based programs that involve families as a critical component, enhance youth outcomes and increase public safety and strengthen neighborhoods. So we're putting that community lens on it and the family lens, understanding that if we can support these youth, the best way to support these youth is to support their entire family, their entire community, their entire ecosystem. And so that brings us to opening up these opportunities for these youth. And as practitioners in the juvenile justice system, we must recognize and address these barriers to success for youth when they are involved in our system. And the best way to do that is what we've done today with the YJAM event, which is hear it from them, not their parents and not their neighbors, but from them that have been involved in the juvenile justice system, but also have navigated the barriers. And now a lot of these youth are professionals themselves or in school, in college, getting their juvenile justice degree or criminal justice degree, business degree, and so forth and so on. Next slide. And so just to highlight a few programs that I think that will benefit you all, for you all to know about as it pertains to sexual risk avoidance education. Just understanding that we have multiple, once you look on our website, but these are four that I definitely wanted to reach out to you, starting with youth with problematic or illegal sexual behavior. These studies show that most of youth who sexually offend come to attention of a law enforcement when they are between the ages of 12 to 14, which is early adolescence, and the peak of age sexual offenses against younger children. And so we have a lot of different instances as we receive reports from these states and localities of the ongoing issue of sexual misbehavior, if you want to call it. And so intervening early and appropriately works to reduce re-victimization, as well as mitigate the negative impact on all youth and families involved. With appropriate and effective interventions, most youth can learn to make better choices and be contributing members of society. And so this leads to sexual exploitation of children, which is another program that we have. The abuse and sexual abuse and exploitation of children rob the victims of their childhood, interfering with their emotional and psychological development. Because yet again, these youth are youth and not young adults. And ensuring that all children come of age being impacted by sexual trauma or exploitation is more than a criminal justice issue. It's a societal issue, which then better yet supports why we always reach out and try to partner with organizations like FISB. Despite current efforts though, the threat of child sexual exploitation remains very real and can occur in the home or in the street or the internet, as we know, in the US and overseas. And so we have tried to create some bridging between us and USAID that addresses more so the international issues and problems. And so sex trafficking and human trafficking, we also address that throughout the nation and the territories, where sex trafficking is the recruitment, harboring, transportation, provision, obtaining, patronizing, or soliciting of a person for the purposes of commercial sex, and the act of commercial sex, in which the Commercial Sex Act is induced by force, fraud, coercion, or in which person induced to perform such an act has not attained the age of 18. And so we're creating more and more awareness around this particular issue, and just understanding it's not just a societal issue and out in the community. We're trying to get into the homes of a lot of these youth and understanding that sexual exploitation happens there as well. And of course, by US federal law, definitely understands the severity of these forms of trafficking. And so, which leads to the last one, which is PREA, Prison Rape Elimination Act. And the goal of PREA is just to eradicate sexual misconduct by residents and staff in all types of correctional facilities in the United States, simply because what we've found, definitely when it comes to the generational curses of these sexual exploitation and trafficking, it does actually reign rampant in these detention centers. And so even if a kid never was sexually assaulted, some of these sexual assaults start and begin a line of bad behavior in these detention centers. And so the Office of Juvenile Justice and Delinquency Prevention, we work with states and territories to ensure that they're compliant with PREA to protect youth in these detention centers. And we use these standards to outline steps to prevent sexual abuse and harassment of youth in confinement. And that's from not only the faculty that teach them in these detention centers, but the staff that also works with them. All of the adults have to take some training that's showing that they know how to work with youth. But this PREA Act also helps support them and protect them from older and bigger kids that are in there as well. And so it's really just an education, but also enforcement of this education that's trying to allow everyone to be understanding of these standards and provide these information services for the victims, but also the potential victims, especially when they first enter these detention centers. And we give the staff the jurisdiction to conduct investigations just from reports alone. They understand from the PREA training that they receive how to actually observe if a child's behavior is starting to change, all of the above. And so everyone is trained annually for this. And we have to go out either as a federal government, and we ask the states to do the same thing as they have to use their compliance monitors to go out to these detention centers and make sure that the training is up to par. And if there are any reports of these issues, that the investigation was thoroughly handled. But that concludes my presentation. But what I do want to add before I pass the mic on is as far as how I do believe that you all can partner with a lot of our grantees at OJJDP. When you receive the resources, we have a lot of discretionary grants there. And one of those links in the OJJDP resources is about funding. So what I would strongly suggest that you all peruse all of those links. Definitely look at all of them, but even with the Title II grant, which is what my immediate division, state and tribal relations and assistance division works with, we work with the designated state agencies, and they oversee the entire state. And so feel free at any time, all of the state program managers, including myself, contact information are on this particular OJJDP website. And we can definitely help facilitate some of the introductions with the designated state agencies so you can get more involved and more in tune on how can your work actually be used with the OJJDP lens and how you can collaborate, simply because when we give the monies to the states, they have to give 66% and 2/3 of that money to the local areas. And so, but it's our job as program managers to help do the convening. So we definitely are always up for collaboration and partnerships, and thank you all for having me today.
Thank you so much to both of our presenters that we've heard from so far. This next section of the webinar will be led by expert consultants from the Capacity Building Center for States. To prepare for this part of the presentation, we held a discussion with the consultants to elicit various themes relating to the experiences of youth in the foster care and juvenile justice systems, as well as gathering specific advice for grantees who aim to provide sexual and reproductive health programming with these populations. The expert consultants decided that a panel discussion would be the best approach to delivering the information to you. One of the center's experts, Raven Prophet, will facilitate the panel, and the other 4 consultants will share their own experiences and thoughts as they answer the prepared questions. And at the end of the webinar, you'll also have an opportunity to ask additional questions of these panelists, as well as the other 2 presenters you've heard from already. I'm going to start by asking the consultants to introduce themselves and give you a little bit of information about their backgrounds, beginning with our moderator, Raven Prophet.
Hi, everyone. My name is Raven Prophet. My pronouns are she and her, and I'm from New York City. I currently serve in the role as a young adult consultant coordinator with the Capacity Building Center for States. And I have 7 years of lived experience, not only just in the foster care system, but also in the JJ system. And now I will pass it over to my wonderful colleagues to introduce themselves.
Hello, I'll jump in there. My name is Eric Warner. I use he, they pronouns. I am one of the lived experience engagement specialist coaches with the Capacity Building Center for States. And in some of my work, I have been a policy analyst for the state of Oregon, as well as providing some specific tailored service delivery on the Division X project for the past year. And I will pass it over to another one of my colleagues as well.
Hi, good afternoon, everyone. My name is Frankita Jenkins. I'm a young adult consultant with the Children's Bureau. Also, I have about 9 years experience in care, also a crossover youth. So I was in foster care and DJJ programming. I have about a decade of experience working in those type of crossover programs. Also, a vast amount of my work has been done in the sex trafficking prevention realm. So yeah, I'm happy to be here with you guys. I'm gonna go ahead and pass it over to another colleague.
I can jump in there. Hi, everyone. My name is Christine Gunningham, and I'm a lived experience engagement specialist with the Center for States. I also have some experience like Eric previously on the Division X project, and also as a young adult consultant with the center prior to these roles. I am also a licensed social worker and previously was a therapist working with youth and out-of-home placement, older youth, adolescents, and also youth adjudicated for sexual offenses.
Good afternoon, everyone. My name is Jazz Snell. I use she and her pronouns, and I am a young adult consultant with the Capacity Building Center for States. My experience is in both the child welfare and juvenile justice systems as a tween and teenager, which has been a generational experience for my family. And I also serve in a consulting role with homeless services, and I have previous experience working within my local COC or continuum of care. And now I will pass it back to Raven.
Thank you so much. So now that we've gone through an overview of some of the data and what the literature says about youth in foster care and juvenile justice systems, from your perspective, from the panel, what do you think grantees need to know about young people with experience in foster care and or JJ systems that they probably don't know?
Yes, I apologize, having some mute issues. But from my perspective, I would say that grantees need to know that everyone engages in sexual behaviors for different reasons and with different levels of consent. So first understanding the why behind a young person or a youth having sex can help to create alternatives to obtaining that why. So whether it be for love, emotional connection, physical pleasure, being under the influence, or simply acting out, as some may say. Another factor is that youth and child welfare and juvenile justice systems do have access to other youth and adults who are strangers or maybe strangers without the protection or supervision of their parents. And this has and can lead to things such as rape, coercion, and other forms of sexual exploitation for many. So these early experiences can negatively shape one's relationship with sex and what are considered to be risky behaviors. So with that, I would say that healing from those experiences and educating on the potential outcomes or unintended consequences should be the priority, opposed to any controlling, shaming, or shunning. And if you do not know, sex is embedded all around us, and youth will learn about it, be it from their peers or by themselves through experience.
Thank you, Jazz.
I think I'll go ahead and jump in there. I think most grantees will agree, even in our prior presentations, that it was noted that youth are resilient. However, that grace is not always extended to youth in systems of care. It's like youth who are duly involved or even involved in one system of care are more subjectified to normal, what would be normal behaviors in the traditional family structure. Be it because everything they do is looked at on the magnifying glass. So I would think that grantees have to make sure that they're approaching youth from a strength-based approach and making the most out of all instances, even if it's being highlighting abstinence as a choice.
Thank you so much for that, Frankita. And my next question is, what are some experiences that might affect a young person's engagement with sexual health programming? And we can start with you, Frankita, if you're comfortable. Oh, actually, no. Oh, sorry, I skipped the question.
Oh, no problem.
Oh, actually, that is the second question. So sorry about that. Yeah. But what are some experiences that might affect a young person's engagement in sexual health programming and why? And we can start with you, Frankita, and then Jazz, you can respond after if you're comfortable.
Prior childhood trauma, especially sexual trauma or abuse, can have a huge impact on a young adult's ability to even begin to think about participating in program, just because that can trigger so many things for them. And youth who have already engaged in program in sexual activities, it can also be a barrier because they feel judged. Even myself as a youth in care, I became a teenage parent, and I was sometimes shunned when I went to any sexual help programming or any of these programs because they felt like I already had made the wrong choice. But like I was saying in my prior answer, youth are resilient. We should never hold an expired story against them. We have to empower them. I'm sorry, you guys, I got a little emotional. We have to empower them to know that the hopelessness they're battling isn't over. So those youth who experience that and are working through that, we have to embrace them even more. So we have to make sure that the total program not is just about abstinence or sexual health, but we're treating the young adult as a whole.
Thank you so much. And now I'll pass it over to Jazz. I think you're muted.
Can you hear me now? Okay. This tech isn't always my friend. I apologize. But yes, I definitely agree with Frankita that experiences of judgment definitely impacts one's participation in programming. And I will also add that experiences related to punishment that may come from disclosing activities. So this can be as far as removal from a placement or the loss of privileges, any socialization, and that does pose real fear in participating in disclosing in an honest way things that you may be navigating. For me, as a young person, I grew up in the Deep South, and I have experienced that Southern culture can be rather punitive and tells young people simply not to have sex without them piecing together the why behind it outside of things such as hell or damnation, disease and pregnancy. So there were a lack of structured conversations around the pleasures of sex, things that young people are going to eventually uncover, and that can lead to more secrecy and leave room for preying behaviors from others. And it also disregards safer ways to navigate relationships and connections that may not put our bodies and our futures at an increased risk through unprotected sex or frequent sexual behaviors with various partners.
Thank you so much. So the research reports that youth in foster care and juvenile justice are more likely to have already engaged in risky sexual behaviors. In your opinion, what are the ways that the SRAE programming can be tailored specifically to the nuances and the needs of young people?
Happy to jump in there and answer that, but first, I do want to acknowledge all of the great information that was just stated. Some of my information may be a little repetitive, but I just only intend that to highlight some of the great points that were made. But essentially, we can't deny the fact of collaboration when it comes to our service delivery and programmings with our community partners and the amount of impact that that really has when it comes to helping and supporting our children and youth and young adults, especially if those partners and organizations that we're looking at are outside of our immediate bubble of influence. So what we should be looking at is utilizing our tribal, state, and local partners in tandem with the current SRAE efforts, specifically calling attention to the state and tribe prep programs or the personal responsibility education programs, which really states the identified goal of informing and engaging youth in body autonomy and integrity as their greatest option for moving forward in these conversations. This, coupled with the continued practice of incorporating and engaging voices of impacted populations, especially when it comes to our youth advisory boards, and keeping a finger to the pulse of the information that they're stating to us, as well as medical advancements, are really going to help tailor these service projects that we're doing and incorporating for our youth and young adults. Again, we do want to reiterate, there's not a one size fits all for this work, and we really have to think about the tailored aspect of this for each and every individual youth and young adult, especially when it comes to representing culture and developmentally appropriate products that we're disseminating to our youth and young adults. All of these materials need to be informed and educated in a way to support and not dictate the journey that our youth and young adults are taking. And I'll pass that over to Christine.
Thanks, Eric. My answer is pretty similar. So first, remembering that all people are individuals, and to really lead with curiosity when we're working with those individuals, remembering that relationships are absolutely key, and to try to get to know people for who they are and what is meaningful for them, and to use that in programming. Ask youth what they want. Let them use their creativity and be a part of guiding that process. And where appropriate, young people can lead or co-lead this work and programming as well. Also, I'd like to add that when there are opportunities to debrief, to try to incorporate that as well. So if you see the young person hasn't been quite receptive, check in on them after and let them know that you noticed, let them know that you care. Also remembering trauma and evaluating if your program is trauma informed and meets the needs of specific populations, and remembering, like Eric said, to ask those questions of who is at the table and also who isn't at the table, to really engage those stakeholders and experts to help tailor programming to better serve the needs of those who are already at the table and those who are yet to come to the table. And I'll pass it back to Raven for our next question.
Thank you so much. That was awesome. All right, so to my next question, is there a way to educate and promote abstinence among youth who have already engaged in risky sexual behavior?
And I will start this one and say yes. All people have moment-to-moment choice of what they decide to engage in. And by definition, when we talk about abstinence, that means refraining from engaging in sexual contact. And any person should have the right to decide if they want to remain abstinent, even if they have engaged in risky sexual behaviors in the past. It's so important that a young person feels comfortable enough disclosing their past experience. And when they feel comfortable disclosing that past experience, we show up in a way that does not judge them and doesn't project shame on them, even if the information feels shocking to us, right? We need to make sure that we're not projecting that judgment and shame. So when a young person does feel that people actually do care about them and their experiences, that they aren't judging them or pressuring them, that really empowers the young person for them to make informed decisions based on the information that was provided. And I'll pass it to you, Eric, to answer as well.
Beautiful. I really could not have said it any better myself. The only thing that I would add is just, I really truly believe, and you'll hear me say this continuously throughout the remainder of my answers, is that when we equip our children, youth, and young adults with the most updated research and developmentally appropriate information that's related to abstinence and sexual or reproductive health, our youth and young adults are going to be able to make the most informed and educated decisions related to their own autonomy and the safety of their decisions and of their bodies. And it's our responsibility to ensure that we're providing those environments that are psychologically safe. And what I mean by that is encompassing their spiritual safety, their cultural safety, their mental, physical, and emotional safety as well. This is a holistic approach to what we're trying to do. Our youth and young adults are in a time of development in their lives, and the last thing that they need to do is feel any judgment. I can certainly acknowledge from my experience, there was a little bit of judgment in high school in my youth days. So I can only imagine that that's perpetuated here. The last thing that our youth and young adults need is a continuation of that from the adults that are really in their life to be there to support them. And so we really can do this by holding continuous focus groups and maintaining, like I said, that finger of the pulse of the medical research and advancement that is really talking to the modernity of what we're trying to do with our youth and young adults. So if that means that we need to adjust some of the messaging that we're doing for our youth and young adults to really meet their needs, we need to do that to meet their needs, not meet our needs. Raven?
Beautiful. And okay, so we have about 3 more questions left, so just bear with me. All right, so what is the ideal best age to educate and promote abstinence and healthy and safe sexual practice, and why?
Yeah, I'll jump in there and I will do my best to make this succinct. I know I talk a lot. But for this, in my opinion, with understanding that the development and the understanding for every youth and young adult is unique, we as the stakeholders and partners in this work need to ensure that we're equipped and prepared to engage in these conversations at any given time. There should also be proactive awareness and preparedness for ensuring that youth and young adults have that psychologically safe space that I referred to earlier. So that way they can initiate or at least engage in these types of conversations and know what questions to ask, or at least find fault or mistake in some of what they're bringing up. So that way they have the opportunity to learn from what they're engaging about or trying to learn from. Most importantly, I do want to hesitate to use the word intervene in any kind of case that we're working with our youth and young adults, because we need to keep in mind for ourselves that our youth and young adults are in a process of learning and should be understood that engaging these youth youth and young adults is tailored to their, again, individual and developmental needs. It's not a one size fits all. You cannot give one person a document and expect everybody in the nation to be able to understand and equip that same document. So in these conversations, we're hoping to express that we carry a weighted responsibility to ensure that we're hosting these events, that we're not working in opposition to our youth and young adults, that we're really identifying and exploring their curiosity and their decisions in their life. So again, supporting their life decisions and their journey and not dictating that. Christine?
Great, thanks, Eric. Yeah, and I would just add too that from the time that kids are very little, we teach them about things like touch and boundaries. They learn about hugs, they learn about hitting and how hitting hurts another person. They learn about feelings and friendship and how to be a good friend. So eventually these conversations evolve over time to develop into conversations around feelings, boundaries, and touch related to intimacy. So the door for these conversations should really always be open, regardless of age. And there are young children who have been sexually abused that may bring up questions. Puberty starts for some youth at 9 or even younger now, the research points to. And also today, young people have access to tech like they never have before. And with that comes the ability to find things and information online. So I think the conversation is more about having those healthy lines of communication at any age. And these healthy lines of communication will allow for, like Eric said, that really important safe space to have these conversations. Because if we are not creating that safe space and holding that safe space, they will go find another space that may not be as accurate and supportive to have these conversations.
Thank you so much. So what are some topics you wish were discussed with you about sexual health or in general?
I can start with this one. So I would say that I wish I learned more about what intimacy and connection was and how intimacy and connection isn't just achieved through sex. Another topic would definitely be identity. I think young people need a space to ask that question of who am I and to explore that without judgment. When young people do have that opportunity, this can help to develop high self-esteem, confidence, develop decision-making skills, reduction of peer pressure. This is all directly related to choices and especially choices regarding sex. And lastly, I would say if young people, like the last question, really need that space to talk about their sexual feelings. And if young people don't have that place to discuss, they go to find that place to discuss. And we want that place to be as healthy and accurate as possible. Eric?
For me, Christine, you hit the nail right on the head with having that safe space. Again, I've hit on it almost every answer. I really didn't have a specific topic that I wished was discussed with me. It was really just engaging in that space where I could bring up questions. My body was going through changes. My mind was going through changes. I needed to know what was happening with my friends who were also going through changes. But there wasn't a space that was dedicated for me to be able to engage in these conversations, let alone to bring up any questions about how I could protect myself or keep myself on a plan of sexual health and understanding. So with that, we need to ensure intentional space for learning, but also to ask those questions to understand further without getting a penalization for that.
Yeah. All right, so thank you all for participating in the panel and for all of your amazing contributions. So now we will transition into the next slide. Thank you all so much. So some considerations for youth with systems involvement. So non-judgmentally meeting youth where they are, being aware of both overt and unseen traumatic experiences and approaching it from a trauma-informed lens. Recognizing the experiences and identities are diverse in culture, gender, et cetera, even across siblings who are also in the same system. Be cognizant of misalignment with where youth are developmentally and educationally. Next slide, please. And also abstinence. Abstinence can still be a focus, even for youth who have already engaged in sexual behaviors, as Frankita had stated previously. Shift from a reactive to proactive lens and start to program earlier. So before the age of 13, as Christine had stated, some young people are starting puberty as early as 9 or even 8, research is pointing to. So wanting to implement certain programming earlier to be able to reach more young people. And also integrating peer modeling into program design. So having young people at the table, not just as a token, but having them actively involved in the program design and implementation process. And then lastly, complementing that approach with wraparound services for systems involved young people. Next slide, please. And now I'll pass it back over to the SRAE team.
Thank you. What an informative and wonderful panel. Thank you all for all of the information that you shared. As a nice follow-up from our panelists, we want to spend a few minutes to clearly make the connection between your SRAE grant requirements and how it can and does align with the needs of youth within foster care and juvenile justice system. At times, grantees feel as though this is a difficult population to reach, but there is ample opportunity and need that the SRAE funding can offer. Some of the requirements are to provide medically accurate, culturally and age-appropriate information, evidence-informed strategies, utilize a positive youth development approach, and address key topics around decision-making, goal setting, self-regulation, sexual coercion, and abstinence. All of which applies to youth and experiences in foster care and juvenile justice. For example, a focus on skill building, particularly around communication, healthy relationships, and self-efficacy, are particularly relevant for young people within foster care and juvenile justice populations. There is also the opportunity to integrate and connect substance use prevention, which is relevant. Some of the same skills around decision-making, negotiation, and assertiveness are necessary for sexual risk avoidance. Many are unaware, but you can educate youth on contraceptive and contraceptive methods. While you cannot conduct condom demonstrations, for example, you can provide medically accurate information on the various types of contraceptives available. And lastly, as the panelists said, your program will be best suited if you have a network of resources, supports, and referrals that can be made to other organizations that provide wraparound services to youth. Next slide. Most importantly, it is necessary to ensure that all your adaptations to programs or activities for these populations are rooted in the positive youth development principles and take an assets-based approach to services. This includes removing stigmatizing language and perspectives, but instead highlighting the resiliency of young people and the great potential they have on a daily basis to make the best decisions for themselves. Your adaptation should also always be trauma-informed, being aware of unique needs and experiences, avoiding re-traumatization, and creating a safe, inclusive environment for young people to learn, grow, and develop. I will now turn it back over to Denise for the Q&A.
Great. I want to open it up now for folks in the audience to ask questions of our, you can ask questions of the original two presenters and as well as the experts from the panel discussion. If you would, you can either raise your hand and come off mute to speak or put your question in the chat. I'll be looking for the questions. And if there is a particular person who, discussed the point or the question that you have, if you want to direct your question to a particular presenter, that would be great. It's possible that the 4 panelists may decide amongst themselves who prefers to answer as well. So I'll go ahead and open it up for questions. Okay, so Daniel Adams asks that we're having problems getting into schools. and youth detention centers, et cetera? Is there a way to go about getting these organizations to open doors for us? How do we find willing partners in our state? Would any of our presenters like to start with an answer to that?
Definitely like to take that one. Thank you for that question. I will be fully transparent. I wasn't born and raised in the federal government. I was a wraparound case manager for 6 or 8 years in Chattanooga, Tennessee. So I definitely know about, I see you, Jazz. But even then and now working on the federal level, the Department of Education has been like the hardest partner to partner with simply because of FERPA, the Family and Educational Rights and Privacy Act, simply because everyone is scared to be sued if they allow any information of these kids, even if we're, as a community-based organization, is there to help them to help these youth. It still doesn't matter because, you know, that is really what they're held to, that type of standard. And so we're still trying to figure out ways to better help and assist community-based organizations from OJJDP standpoint to partner with these school systems. And that's the only way I've ever seen it work. It has to be some type of memorandum of understanding that you'll have to sign as an organization with the particular schools that your youth are attending in order for any type of partnerships to work. Otherwise, they're scared to touch it.
Thank you. Would any of our other presenters like to add to that, or should I go to the next question?
I would like to add
Michael,
something quickly.
Oh, yes.
Oh, I'm sorry. I seen someone had their hand raised.
Well, why don't you go ahead with this question, and then we'll get to Michael Ellison's question in a minute.
Like Mr. Hall was just stating, like the memorandum of understanding is like the absolute first thing. In South Florida, because we're a little untraditional society, we do have a lot of programs that operate either being a community-based setting or a youth detention setting. But it is possible. It does take a lot of fleshing out things from the beginning to make sure you guys have a concrete understanding. And all the programs that are school-based here are not mandatory, so they're voluntary-based programs. So I just wanted to throw that out there.
Thank you. And I want to recognize the question that Stephen Forrester posed earlier on in the presentation. Question is it important for teens to understand that the behaviors are in fact at-risk behaviors, and why? Does anybody want to take that one on?
I can start with that one. I think it's important, and I think that was in response to a comment above too about risk behaviors and judgment and shaming and creating a safe space. So I think it's important that any choice we make in life has an outcome, whether we call it risk, consequence, it has an outcome. So when we work with young people, I think having them to think through, if you engage in something, what are the possible outcomes? So if you engage in unprotected sex with multiple partners, what are the outcomes? And have them tell you. And if they don't come up with all the outcomes, then that's an opportunity to say, could this happen? Could this happen? Could this potentially happen? So it's more of a non-judgmental conversation of choice and outcome, I think is a good way to potentially reframe that. And I will give it up to any of the other presenters who may want to chime in as well.
I just want to chime in briefly. I like so much what you said, Christine. I think the only thing I want to add is that it is important to educate youth on risky behaviors. And like you said, there's always that opportunity to learn from what they don't know. But most young adults have an idea of the risk behind certain behaviors. So a focus should be put on more than creating a safe space for them to make these mistakes and then subsequently learn from these mistakes, rather than just telling them, this is bad, this is bad, this is bad, because you get more from a person if you like you said in your example, Christine, allowing them to see the opportunity for them to grow within themselves rather than telling them, oh, you need to do this.
And I see Michael Ellison's hand is raised. Would you like to ask your question?
Yes. Well, kind of a statement. Anna asked a question. We presently work in some of the juvenile justice facilities in Georgia. One of my concerns, and I'm glad this conversation is being talked about. I mean, we've been with open arms to go into the system because most time they want something else for the kids to be involved in. So that's really helpful and was a good opportunity for us. But one of the things I would like to see worked on with the facilities in the general area, you know, one facility may do things this way and another facility would do it a different way. So if there's some consistency across the board in working with us, like in one facility, which is closed now, they didn't want us to have any names. So my question was, well, how are we supposed to do their certificates? And we give them a tent card to put their names on. It's not like we don't see the names. We want to be able to call them by their names rather than, hey, you, you know. So, and then there's a certain amount of information that we have to report, because the other thing with that is if we do a lot of them and they may transfer from one facility to another one, we may not always remember that they've already been through the program, so we can't duplicate. So it's the only way we're going to know that is to have a name. So I just hopefully something like that will, you know, work out for that. And as it relates to the schools, we're also in the schools. You really just have to find somebody who know people in the schools and just talk to them, because it's really left up to the superintendent of the schools. And in Georgia, with a lot of the different political laws that are addressing sex and all of that now, is really putting a stickler on that now for the state of Georgia, but we're still presently working in the schools. Thank you.
Thank you for those comments. Does anyone want to follow up on that?
Just one thing to Mr. Ellison's point. What I have seen done before, Mr. Ellison, as far as I will go ahead and tell you, every state is different, and we try to get people to dance to the same tune, but we don't have the authority, you know. So only thing we can do as a federal government is educate and support, and you know, but otherwise, you know, states have their own laws, as you know. But what I have seen when people do get pushback from detention centers about things such as yours is the common ground